More businesses like restaurants are opening, yet a new study suggests dining out could increase your risk of getting COVID-19. So what should you consider before you make plans? And what are the next steps as the researchers continue efforts to develop a coronavirus vaccine? Dr. Nicholas Testa, Chief Medical Officer for Dignity Southern California, is here to give us his perspective. Always a pleasure to have you join us. Good morning, Dr. Testa.
Thank you.
My first question, a new research is taking place, and it's taking a closer look at how COVID risks are raised when eating in a restaurant. Can you discuss the findings of that study, especially in light of the fact that we're now starting to see more businesses reopening?
Sure. So the study was published in the CDC Weekly, came out, I think just about last week. And what it looked at was a case control study. So it looks at patients who had contracted COVID versus those that had not. And what it found was that patients who had contracted COVID were twice as likely to have eaten in a restaurant in the previous weeks. So connecting that there's increased risk for eating in restaurants, going to bars, or those public venues that we're starting to return to.
Okay. So progress is being made towards a coronavirus vaccine, but how safe and effective does it need to be before we decide it's ready?
Right. It's a great question. So as far as efficacy goes, what the FDA has asked for is that it's 50% effective. So it doesn't have to be 100% effective. The first one may not be. But if it's a 50% effective, that's a big step forward. As far as safety goes, remember, we're in phase 3 trials, which are the efficacy as well as safety trials for the current vaccines. There is a very good chance that the vaccines will be released early, and the use will start prior to the phase 3 being completed. That's through the emergency authorization. But keep in mind that the majority of complications that we see with a vaccine are usually in the first few months. So the vaccine that comes out, I'm pretty confident, will be safe. The key is, though, we will continue following that longitudinally into time to see if there are long-term complications. And remember, there's multiple vaccines out there, so we may pivot and switch to a different one. This is all going to be a work in progress. Remember, we've made all this progress in 7 months.
Yeah, very quickly. And so once a vaccine is approved for use beyond those clinical trials, what is the next step?
Yeah, so there's 2 steps that are going to follow. One is we got to figure out distribution, right? So we'll have to figure out how do you get, at least for the United States, millions, if not hundreds of millions of vaccines out. So we will have to create the distribution network. But there's another thing that's going to be equally important, that's acceptance. So there is a lot of concern, even based on the previous question you just asked me about how safe is this vaccine going to be. So what we're going to need to see is campaigns that are really transparent in sharing the safety data with the public so that people feel confident about the vaccine.
Yeah. Okay. All right. Thanks so much, Dr. Testa. We hope you have a great weekend. We'll see you again next week. Thank you.
Thank you, Giovanna.